The views expressed in this podcast do not reflect those of our training institutions or the APA. The information discussed is intended for educational purposes only and should not be used for diagnosis or treatment. Enjoy. This podcast was recorded on June 30th, 2020. Some of the news discussed may have changed by the time you listen to this episode. We discussed topics in sports psychiatry, including mental illness in college athletes, its effects on athletic performance, stressors unique to this population, factors when choosing treatment options, ethical considerations, and more. Hello, everyone, and thank you for joining us again here on the AJP Residence Journal podcast. My name is Bharat Sampathi, and I'm one of the editorial board members of the journal. Today I have with us Dr. Bettina Frankel. She is a psychiatrist at the Counseling Center of Northwestern University. As part of the sports psychology team, she has been treating Northwestern's Division I varsity athletes for the last 6 years. She is a representative for sports psychiatry in the Association for College Psychiatry and a member of the International Society for Sports Psychiatry. She is originally from Germany and received her medical degree there. After her residency at Harvard and Northwestern, she has been working at the Northwestern University's Counseling and Psychological Services Center for 23 years. Dr. Frankel enjoys mentoring younger psychiatrists, and we're glad to have her here to discuss the topic of sports psychiatry. Hi, Dr. Frankel. Thank you for joining us today. How are you doing?
Thank you for having me, Bharat. I'm doing fine. How about you?
I'm doing well. I actually just finished my first year of residency, and I start my second year tomorrow.
Congratulations. That's great.
Thank you. So since we're talking about sports psychiatry today, the first thing I wanted to ask you is if, given COVID and the recent pandemic, if you feel like collegiate sports will be back in the fall.
I think I fall in line with everyone else. I have no idea.
Yeah.
So what people probably have read about is that student athletes have returned, not to all, but to most university campuses in Division I schools for voluntary workouts in football and basketball. We started those on June 22nd. If you follow the news, you also probably have read that at several schools, among them Clemson and Alabama, quite a few football players overall tested positive, and then they had to quarantine those students. So I think it's really very much up in the air, particularly now that COVID cases are soaring in quite a few states, and that we realize that the younger age group is really very affected and seems to be the source of a lot of spread of the disease. The other thing that is very important to realize is that universities operate under the state, municipal, and federal guidelines, and those might be subject to change.
Yeah, I saw that a couple of days ago. I think we hit a record high for new cases for COVID. Definitely seems like a surge might be coming. And regarding to the Clemson football program, I was reading that 37 players tested positive. And I don't know how many players are on each Division I football team off the top of my head. I know in the NFL it's about 50 something.
No, it's 100.
It's 100. Okay, so still a pretty large percentage of their team. And I'm just wondering how athletic commissioners, are thinking and triaging. Maybe the NBA will be a test run, given the fact that they're starting in Orlando at the end of July. I guess we'll see how it goes.
It is hard to imagine how football and social distancing go together.
Yeah, especially given the fact that it's close contact, you're breathing all over each other with basketball and football, water polo, soccer. Mm-hmm. So being able to decrease the risk of spread seems very difficult for those sports. I agree.
What I think is very clear is that athletes and fans are very eager for sports to return.
Oh yeah, me included. I honestly have been itching to watch the NBA again, but obviously, health takes priority, so we'll see what happens. So Dr. Frankel, the reason I was interested in talking about sports psychiatry is because of the element of athletic performance. You have the opportunity to work with a group of people who, for some, value their ability to perform on the court or field more than anything else. And an important concept here to me is that mental illness can contribute to poor athletic performance, or mental illness can arise from underperforming or the pressure players place on themselves. But regardless, I think there are many reasons for mental illness in athletes because they're people just like all of us. Mm-hmm. But I do feel like the topic of sports psychiatry is a rising field that needs more attention, which is why I was hoping this podcast would shed some light on this field to trainees like myself. So to start off, I just wanted to see if you could give us a description of what sports psychiatry is.
So I want to pick up what you mentioned. Athletes are people. So athletes get mental illnesses at about the same rate, as much as we know, as the general population. And so they need care. The care is complicated by the performance aspect, but also by having, and I'm thinking specifically of the student athletes that I see. I'm a psychiatrist at Northwestern University, so I work with student athletes, Division I, varsity student athletes. They have so many demands on them. So they have academic demands, which is about a full-time job, and then the athletic demands, despite NCAA rules, really add up to about another full-time job. So they really have very little time for self-care, but also very little room for error. When they are in their season and they are competing, they're constantly judged, right? They get a result right away. You win or you lose. They also often feel very or are very aware of their image.
Mm-hmm.
If they are prominent athletes, of their image within the bigger community, but even the image within their team, the image that their coach has of them, whether they are seen as a reliable performer or whether they are not a reliable performer, whether they're not seen as strong and resilient. So all of those things play into their persona to the outside, but also in their self-image. So that's really something that has to be taken into consideration. So doing psychiatry for athletes means that you, one, are very aware of the stigma and of the dynamics that play a role for people who are performing at such a high level and are so determined and driven. And also that you know about their season. So if I want to start a swimmer, let's say, on an antidepressant, which is something that we do with people outside of sports all the time without any consideration, I cannot do that right before the main tournament of the season, which for our swimmers is the Big Ten tournament and then the NCAA tournament, because they trained an entire year to be in peak performance shape at that one point in time. And they're not going to risk any side effects, anything that will impair their performance. So the season plays a huge role, then injuries play a role, concussions, the physical part comes very much in there. Kind of as if you were working with a medically ill population, you also, when you work in sports psychiatry, you got to be more aware of the physical medical health. So we work very closely with the sports medicine team, athletic trainers, with sports medicine physicians, with sports nutritionists. All of those play a role. Athletes usually have a team around them that takes care of their health, and mental health is just part of that. So that is very important, and I think is often not the case unless you work on consultation liaison or you are working with a geriatric population. But in general, it plays less a role, I think, and there's less of a team when you work in general psychiatry.
So it sounds like sports psychiatry involves a big team that involves sports medicine doctors, nutritionists, sports psychologists, psychiatrists like yourself to provide athletes with this holistic experience so that they're staying well both mentally and physically to perform at their peak ability and also stay well at the same time.
Yeah. So I'll give you an example here. So I see football players because it's a Division I sport and we have like 100 football players, like most schools that have a football team. And if I see a football player that has ADHD, then they need the ADHD medications to stay organized and for their academic performance and often socially. They need the medication, but they also need to make weight. So let's say there's an offensive lineman. They come in as freshmen often at 250 pounds, like they're 6 or I don't know, 5 or something. They often are asked to gain weight to 290, 300 pounds. And to do that within a span of a year, which is usually kind of where they are, while you're taking stimulants that suppress your appetite, is incredibly difficult, if not impossible.
Wow.
So collaborating closely with a sports nutritionist is really crucial.
Mm-hmm. So it sounds like the stimulants that you're talking about are Ritalin and Adderall, which suppress your appetite more so than the non-amphetamine based medicines like Strattera, correct?
Yeah, well, the non-amphetamine based medicines, so the non-stimulant medications are really second line. They are not first line treatment and not the most effective treatment for ADHD. And Northwestern is a really competitive environment. So
Mm-hmm.
I very rarely, I mean, if you have someone who cannot take a stimulant for whatever reason, then you have to try another medication. But other than that, we usually try to do either methylphenidate or amphetamine salt preparations.
And Northwestern obviously is a very competitive school academically as well. So I'm just wondering if these athletes are also,
Yeah.
in addition to having to perform on the field, do they come to you with a lot of stress in terms of trying to balance their workload and in the classroom as well?
Yeah. I mean, I think that's unique for schools like Northwestern and Stanford and maybe USC. There's quite a few, the Ivy Leagues. There's quite a few actually highly competitive colleges, state colleges too, like a lot of them come to mind. Academically competitive colleges also have Division One teams. Yes, the academic performance is extremely important to student athletes and to ours as well. And we see a lot of athletes who choose Northwestern above other schools that they were recruited by because of the academic reputation. So I see often students who study to be engineers or pre-med or economics. And I think most schools, but I think Northwestern is unique in the quality of the academic advising for student athletes that it has, but we have extensive academic advising for student athletes, and they really make sure that these kids stay on top of their academic work. And it's very, very stressful, especially when Northwestern is on a quarter schedule, so that it doesn't really jive very well with the athletic, competition schedule. And our students often have midterms or finals at the same time as they have crucial, essential athletic competitions.
Yeah, I can't even imagine having to balance, your academic workload while you're on the road, with basketball and football for days at a time. I'm also assuming they miss a lot of class. Is that true? Especially during the season?
Yeah, that if you take our women's softball team during the season, especially initially when it's still cold in Illinois, but the season is already going on, they basically travel starting every Thursday for weeks on end. They miss Friday and often Thursday afternoons classes. When our basketball team hasn't made the NCAA tournament more than once, but when they did make it, everyone else had spring break, and our team traveled with athletic academic advisors, and the student athletes took economic finals on the road.
Wow, okay.
So they often get off the airplane and then they go to the hotel room and they sit down and write in the test.
Wow, that's a lot of pressure to have to do that. And you mentioned ADHD as one of the common diagnoses that some of the athletes you work with have. Are there any other psychiatric diagnoses that are common amongst college athletes, like depression, anxiety, or other mood disorders?
Student athletes, just like all the other college students, have all of the common mental illnesses. And as you know, mental illness often occurs for the first time or gets much worse in the young adult, emerging adult phase of life. So, yeah, we see a lot of anxiety, we see a lot of depression, but we also see eating disorders, substance use, OCD, bipolar disorder, usually bipolar 2, but not always. What I see hardly any of is schizophrenia. And I think that is more due to the fact that, it's really hard. I mean, it sometimes prodromal students make it to college. I think it's very hard. I have not seen it. It might happen, but to be prodromal and be able to balance an athletic and an academic schedule so successfully that you make it to college, to this kind of college, to Northwestern.
Yeah, and you mentioned briefly you were talking about a swimmer who would likely have been started on antidepressants, but you can't in a situation where the side effects may affect your performance. So one question I had that was really interesting to me is if someone is coming in with bipolar 1 or 2, and let's say they're on the basketball team and you wanted to start them on lithium or Depakote, both which have, weight gain as a side effect. I'm just curious how often you work with athletes who have trouble staying on medications due to the side effects, because, weight gain, and if your speed is slowing, your ability to react in fast-paced situations is worse, it's hard to want to continue to take meds. So I was just wondering what your experience has been in that regard.
Yeah, so I personally have not, I've used atypical antipsychotics in very small doses. I have not started, it's not such a common occurrence. And I think all of us, if we can, in the sports psychiatry world, if we have someone with bipolar 2, or we need a mood stabilizer, let's say, and it's not terrible, we usually, I think, try to use lamotrigine because of the side effect profile. I've used Abilify in tiny doses, but it's very rare. And I think you're right. Weight gain or sedation are not things that athletes tolerate very well. And, you don't usually lead to non-compliance. So unless someone wants to gain weight because they need to gain weight for the football team. But even medications like mirtazapine, I've used it very, very rarely because it's really not something that students tolerate very well. I think not just student athletes, but students. Now, you got to remember, I'm a sports psychiatrist in a college context. So I cannot speak for, if you think of the International Society for Sports Psychiatry, of which I'm a member, my colleagues there work with all kinds of teams. So they work with professional teams, they work with youth sports, they work with Olympics athletes, and their experience might be very different. I cannot speak to having started people on any kind of significant number of people on medications that have, atypical antipsychotics or anything like that. I think Claudia Reardon of University of Wisconsin has published a lot on medications to be used with athletes, and the general recommendation is to use lamotrigine for mood stabilization whenever you can and it's reasonable. Now, if you have someone who has acute mania, that's not going to be your choice.
Yeah, that's interesting. You really have to take into account what the athletes also want in terms of their season. And I think that makes it a little harder than, let's say, a layperson, that is working as an engineer and
Well, I gotta say, most of young people that I don't just see student athletes, I see some regular college students too. People that age do not take well to anything that's really sedating, gives you bad acne, or makes you gain a lot of weight. So, you will always have a hard sell for some of the medications that you just mentioned.
I see. Especially 18 to 22-year-olds, you're coming into your adulthood, and self-image seems to be a priority to a lot of people in this age group, correct? Yeah. So side effects like weight gain and acne can be hard for this age group.
Or being sedated when you have to, write a stellar paper on the Vietnam Wars or something like that. Yeah, no, it's really, or, pass advanced macroeconomics or something like that. It's not easy to, and I don't think psychiatry is alone. I have in that. Many other medications, many medications for other conditions, I should say, also have side effects that could include weight gain or could include sedation or cognitive slowing. I'm thinking of, let's say, anti-seizure medications, right? It's not just psychiatric medications that have these effects. What you have to take into consideration for athletes, similar to musicians, is that some of the motoric effects that medications can have, so some of the SSRIs can lead to tremors, or rare side effects, people having visual trails with fluoxetine. That's a very rare side effect, but if you are a baseball player, that's really not a good choice.
Yeah, that's a really good point.
The key, as most times, is to try to collaborate with the patient, and I think in a college setting, as in other settings, the more collaborative you can be and the more open you can be about side effects, then the better, the higher your chances that you actually hear about the side effects when you can still change something rather than after the fact and the patient has discontinued them. on their own.
Yeah. So some psychiatrists are obviously more prone to prescribing medications than others. Others would like to try therapy for a longer period of time. So I was just wondering in your practice where you are in terms of the balance between therapy and working through stressors and pharmacological management of symptoms.
So I'm really fortunate. I work with some great sports psychologists who are just really good. So I do some therapy myself, but as most psychiatrists, do mostly psychopharmacological treatment. But I do some therapy. So usually I try to get students to first try therapy interventions. But if they've tried for a while and it didn't work, or the symptoms were so severe that it's very clear they need a medication, then restart them on a medication. I do feel like with the recent data, that's like about a couple of years ago out of Holland, I believe the study was, about tachyphylaxis in with SSRIs and anxiety, I push the students a little more to try therapeutic interventions before I start an SSRI. No, I hardly, I will give people who obviously, like most psychiatrists, even a student athlete, if they have terrible panic attacks all the time, I will give them some clonazepam until the SSRI takes effect. But student athletes are even more reluctant than other students to take this because of the sedation.
I see. And yeah, in regards to the medications, ADHD medications and then others like the benzodiazepines that involves the cures database, do athletes need approval from the NCAA to be on such medications?
Not for the benzos. They can be on benzodiazepines, but for stimulants, the NCAA doesn't have to give approval. You fill out an NCAA exception form. So there is a form that basically you have to list. It has to be filled out by the prescribing physician, and it has to fill out the diagnosis, how you got to the diagnosis, what kind of standardized instruments you used to get to this diagnosis, what your treatment plan is, comorbidities, time frame. And this is mostly because they might test positive, right, on drug tests. And then it needs to be clear that they are taking this for a legitimate medical condition and not because they want to be hyper alert. Because there's this discussion, can stimulants be performance enhancing? There's a little bit increased cardiovascular ability. They also could be performance impairing if you think of a midfielder on a soccer team who needs, or let's say a point guard on a basketball team who really needs to be able to have a view of the whole field and needs to be able to be fairly spontaneous in their decision making. Both of those can get crimped by taking a stimulant. And I have had student athletes who say, I will take my stimulant when I have to learn the plays or when I have to study, but for performance in practice or in competition, I do much better without them.
Does it cause a bit of a tunnel vision during athletic performance in terms of not being able to focus on everything that's going on in the court, but rather just, one certain aspect? Is that what athletes struggle with?
Well, the effect of the stimulants on people with ADHD is very idiosyncratic. So yes, some people describe hyperfocus and what you just called as tunnel vision. But it focuses you. And there has been a debate that it's even like in Fortune magazine, I think someone wrote an article that maybe some athletes were such great athletes or are such great athletes because they have ADHD. So yes, I mean, if you think of a baseball player or a fencer, let's say, or a swimmer who has to make sure that the stroke is the same every time they do it, those are people who probably need the ADHD treated to perform optimally athletically. But if you think of, a point guard in basketball or soccer, field hockey player, that's a different story. So it really is working with the athlete and then discussing with them that it really is not appropriate to take this for performance enhancement. And then that it's an ethical decision, right? Is treating a pre-existing medical condition performance enhancement, or are we just treating a medical condition, right? We would probably not send someone who has a painful muscular skeletal injury. We probably wouldn't require that person to play without taking ibuprofen.
Yeah, I think that's a very interesting discussion. How much of it is returning someone back to baseline so they can perform, and how much of it is actually increasing their performance to what would be greater than how they would usually perform, I think is an interesting debate I've had with some of my colleagues.
Yeah, there are sports psychiatrists who would disagree with me and who would definitely start out trying to use a non-stimulant ADHD treatment.
I guess it's psychiatrist specific and also player specific.
Mm-hmm.
And then I guess in college there's a problem, right, in terms of access to Adderall. It seems like it's pretty easy to obtain the medication. Do you ever have athletes that are self-medicating?
Well, what we know about college is yes, Adderall and stimulants in general are abused, by a fairly large percentage of people. I think 17% of college students do non-medical use of stimulants.
Wow.
But not a small percentage of those people are people who have undiagnosed and untreated ADHD. So for an athlete, it's much harder to do that because they regularly get drug tested. I see much less use of marijuana or, experimentation with all kinds of other drugs. Like I think currently microdosing psychedelics is the new fad. I don't see any of that, or very little of that. Not, I wouldn't say any, but very little, because the athletes live in the constant awareness that they might get drug tested randomly at any time.
Yeah, and also in regards to, from what I understand, when someone redshirts, it's usually from a torn ACL or an athletic injury that stops them from being able to compete for 6 to 9 months at a time, maybe a year. Is there something in place in the NCAA for people to take a leave for psychiatric reasons?
I believe that you could redshirt for psychiatric reasons. I'm not sure, but I think yes, you can have a medical DQ for psychiatric reasons. You can take a medical leave of absence for mental health reasons. I wouldn't see why you couldn't redshirt for mental health reasons either. I didn't look that up, but I believe that I've seen people who've taken a season off for an eating disorder, let's say.
Okay, it's good to know that there's possibly a way for people to take a year off to take care of their mental wellness, which is as equally as important as recovering from an athletic injury from a performance standpoint and an overall wellness standpoint.
The NCAA and the universities, at least the one where I work, really make every effort to treat mental health concerns with the same gravity and the same fairness and the same way they treat, other medical issues.
Oh, that's good. And then have you noticed any difference in the prevalence of mental illness by sport or by gender?
Well, just like in the general student population, we see more women than we see men, slightly. I recently presented on depression in student athletes at a conference, and it looks like people in team sports have a little less prevalence of mood disorders than people in individual sports, which makes some sense because you have the cohesion of the team. And it's not huge, but there is a little bit of that. There have not been many studies. If you think of, we have a cross-country team, and we also have a lot of team sports, and we have swimmers. And I think someone who can push him or herself to swim, 10 kilometers a day or to run 70 miles a week, that kind of discipline usually goes along with a personality that's maybe a little more prone to anxiety, but I wouldn't want to generalize. It's just, I have no study to back that up. That's just anecdotal personal impression.
That's an interesting point, because I feel like people that set high expectations for themselves athletically may also be, especially at a school like Northwestern, setting high expectations for themselves academically, and then, it becomes a lot and potentially boils over. So, even though there might not be any research studies, that makes a lot of sense to me. And the concept of discipline actually reminds me of mental illness in medicine. I think trainees and working doctors, research has shown that we are much more likely to experience mental illness. The prevalence of mental illness is much higher in our field. And I think part of that comes from the discipline and the need to push in the field, starting from day one of medical school, through residency, through work as an actual attending. And sometimes doing this, we sacrifice our mental health. And I think that makes us more prone to mental illness. So the similarities there are interesting to me, even though athletics and medicine are two entirely different fields. Okay, moving on. Could you spend some time talking about the healthcare model you have at Northwestern? Particularly, you mentioned it briefly in all the different pieces in terms of the treatment team that are involved in the well-being of athletes, but maybe something that sets Northwestern apart from some of the other schools.
Yeah, so Northwestern made a decision 6 years ago or so to have all of the health care and mental health care for the student athletes not based in the athletic department, but in the health service for sports medicine and in the counseling center for sports psychology and sports psychiatry. And most other universities, not all, but for many universities, at least the psychological services, so the counseling, the sports psychology services are often based in the athletic department, and sometimes sports medicine, I believe, is too. So Northwestern is unique in that way that we have it based out of the counseling center. I think it makes for, we as health providers, whether it's athletic trainers, sports medicine physicians, sports psychologists, nutritionists, or sports psychiatrists, we are on the side of the athlete, or the athlete on the side sounds too controversial, but the athlete is the focus of our interest and our care. And when you're in a sport environment, that is crucial to maintain because it's very easy to be swept up in the, general rah rah. We got to get, the Wildcats for Northwestern or whatever it is. We want to win. This team is doing good. It's very, very important that the athlete knows you are their advocate. You're there for them, not for the team. Your main concern is their mental health, not their prompt return to the field because they are a major pillar for their team, let's say. And I think that's the case. That's the ethics for everyone who works in this field. But it's a lot easier when you're not based in the athletic department. I really like that.
So from what I'm hearing is Northwestern bases their entire model of psychiatric care for athletes through their counseling center rather than in the sports department itself.
Mm-hmm. Yes.
Okay.
And I think what's unique for Northwestern also is that there is a psychiatrist, i.e. me, who's just there for the student athletes, but a lot of counseling centers and universities contract their psychiatric services out. Some work with the Department of Psychiatry. For some people, the psychiatrists are based in the health service. So there's a huge variety of models in the college and university mental health fields. But for us, me being really there and being part of the team makes it very much easier, communication, collaboration, all those things.
It's kind of like one cohesive unit.
Yeah, we have a couple of really good multidisciplinary teams too that work very well for eating disorders is one of them. It's easy to collaborate.
Yeah. And speaking of collaboration, are there any large-scale research studies or statistics out there regarding mental illness in collegiate athletes?
Well, I think the research studies there are say pretty clearly that collegiate athletes don't have higher rates of mental illness than the general college population.
Okay.
Now, I think that still, though, makes for a pretty high rate of mental health issues just because needs for students have been rising. I'm sure you've heard that. It's basically a public health crisis. I looked something up prior to this interview because I know we were going to talk about this. And in the 2018-2019 academic year, 36% of students experienced depression, 31 experienced anxiety, 24 reported engaging in self-injurious behavior, and 14% had suicidal thoughts. So that's, I think, the Healthy Mind study. So different studies have shown that said that between 6 and 25% of student athletes have depression. And there was, I guess, a study that said that 35% of professional athletes had some kind of major mental health issue. So there have been studies out there, but I think student athletes basically are no different. They might be just slightly less prone to suicide, but we don't really know. I mean, they have a team around them, student athletes. Most student athletes, get seen almost daily, not just by their coach and teammates, but often also by an athletic trainer. So it's more support.
Yeah, and I think it would be interesting to see where the mental illness starts because I was looking at some research studies that have been showing that psychiatric hospitalization rates in youth has increased every year for the past decade. So not only in college mental health are the rates alarming and it's almost crisis-like, but it seems like it's even occurring earlier. So it'll be interesting to try to determine when exactly mental illness is starting for young adults and teens, if it's happening for the first time in college, or if mental illness was always there, but it just came to light due to the additional stressors of being a college student and athlete.
Yeah, I think college certainly is stressful, but also that is just a time. And that has been not the numbers we are seeing now, but that emerging adults, young adulthood, that is a time where major mental illness occurs for the first time or gets much worse. That has been known for a very long time. But the numbers overall are increasing, and that's very concerning. I think I read somewhere that there were 1 million visits last year or the year before for suicidality to emergency rooms of persons under 18, and like 30% of those were for people under 11. It's just for suicidal thoughts. Obviously, it's not suicide attempts, but I mean, if that's true, and this is a vague recalling here on my part, so maybe that bears some looking up, but then the current public health crisis is not going to abate.
Yeah.
Our numbers have been increasing and nationwide numbers have been increasing for the College Counseling Center.
Has the recent trend of professional athletes speaking openly about their own mental health struggles led to more collegiate athletes reaching out for help? Off the top of my head, there's Kevin Love, DeMar DeRozan, Meta World Peace, Coco Gauff, Brian Dawkins. There's a lot of professional athletes that have been starting to talk about their own mental health. And I'm just wondering if that's helped to mitigate the stigma against mental health that exists in collegiate sports.
It's hard for me to tell whether it's for our university, whether it's just our student athletes or whether it's professional athletes speaking out. Brian Hainline started as the NCAA's chief medical officer, I think is his title, in 2013 and talked to the Student Athlete Advisory Committee, and they told him that in addition to concussion, which is was his expertise and still is, I'm sure, they really felt that the NCAA needed to do something about mental health. So that's 2013. The NCAA then had a mental health task force. They came out with best practice guidelines, but it all started with the student athletes saying, we need this. This is a huge issue. And I think professional athletes coming out certainly destigmatized it some. For us, we recently had a panel of 3 prominent student athletes who were alums who came back to talk about their mental health treatment in a town hall. And so we've had a student athlete give, I think, interviews. There's a student-led where they identify students that are willing to talk about mental health by tying a green bandana. I think it's a green bandana to their backpack or somewhere. Athlete mentors, purple peer mentors, I think is what they're called, that we trained them in suicide prevention, like gatekeeper training, QPR. There has been a lot of activity in addition to the professional athletes coming out. I think all of it together is contributing to destigmatizing mental health care, which is great. I wouldn't say our work is done. I think it's still difficult for athletes to come out, student athletes, professional athletes, really anyone, to be open about their mental health struggles. But, we've come quite a long way too, even though there's still quite a bit to go.
Mm-hmm. And I remember you mentioning when I first approached you with the topic that University of Michigan has a website called Athletes Connected. And I actually visited it, and it's an awesome website. It has players from football, volleyball, swimming that are just open and talking about their struggle with mental illness. And I think even just having a website like that athletes can go to probably really helps in terms of allowing athletes to feel more comfortable to be like, hey, I think it's okay for me to get help. It's okay for me to talk to someone.
The Big Ten recently got a new commissioner who, as one of the first things, getting together a mental health cabinet. But there is certainly a lot of activity trying to destigmatize it. Tragically, partly prompted by, student athlete suicides. There have been quite a few student athletes who took their life, or athletes that might have been just out of college. So I think everyone's aware. The International Olympic Committee got a group of people together, expert together in 2019, and they wrote an entire issue in the British Journal of Sports Medicine about mental health. Some of the members of the International Society for Sports Psychiatry, like Claudia Reardon, was involved, as was Brian Hainline, the NCAA chief medical officer. So the US Olympic and Paralympic Committee just announced last April, that they are starting a mental health task force. So it's out there, and the different organizations are trying to destigmatize it and trying to help people get connected to services.
That's great. Can you speak to the mental health of student athletes that are trying to go pro but are unable to do so, or athletes that have to hang up their cleats or jerseys upon graduation?
I can't speak for people who've been trying to go pro and didn't make it, that I can't speak to. But what I can say is that one of the more difficult times in an athlete's life is when their career ends, the transition out of the sport, trying to find other means of adding meaning to life, filling all of that space, that support, and the team cohesion. That's difficult. It's more difficult, obviously, when it's with an injury, forced retirement, which is not so infrequent. But that transition out of sport is certainly something that's difficult. But most students who come to Northwestern to be athletes see this as a culmination of their career.
I see. Another question I had was, how have sports psychiatrists in schools addressed mental health for Black athletes, especially now given the recent tragedies and the obvious issue of systemic racism?
Yeah, that's a really good question. So the sports psychology and sports psychiatry community has really tried to support Black student athletes with town halls that were open to all athletes, with extra services. Northwestern at least has a Black Student Athlete Alliance that has obviously reacted to this. There has been a GoFundMe campaign to support Black businesses and rebuild neighborhoods. I mean, it's difficult in the time of COVID. So all of these gatherings obviously have been on Zoom or other technological platforms. But there's certainly been a lot of outreach, a lot of community creating. Northwestern just appointed a chief officer for diversion and inclusion. I think they're trying. Our football coach, I know, had long meetings with all of his players trying to support the Black student athletes. The systemic racism and the fact that it's, as a Black man in the United States, you never really can feel safe. I mean, we can support our athletes, but society needs to change.
Yeah, I agree that while schools can do everything in their power for Black students and athletes, change ultimately is more monumental when it comes from society as a whole. But nevertheless, I think it's great that schools like Northwestern are staying active in the fight for equality.
I mean, I'm on listservs from sports psychology and sports psychiatry, and I have gotten so many materials and links for student athletes to gatherings and town halls, et cetera, that are open not just to the local student athletes, but to everyone. Northwestern Black student athletes, they made a video. Student athletes are active, but universities all across the nation are active.
Wonderful. And just a few more questions. So what got you interested in the field of sports psychiatry?
So most people who do sports psychiatry have a background of being athletes themselves, either in high school and college, maybe even some professional, I don't know. I have worked for Northwestern's counseling center for 23 years or so, and wanted to increase my hours at a certain point in my career because it fit what was going on in the rest of my life. And the university happened to start the sports psychology unit with some sports psychiatry hours at the same time. And so I said, yes, I would love to do that. And then I learned about it. So I am unusual.
Well, I'm glad you stumbled across it. How have you liked it so far?
I love it, yeah. I love the work. I can follow people for a longer period of time. I love working in a team. I mean, I chose working with emerging adults before because it's a great population to work with. And yeah, I love my work. and a lot of my colleagues. Very, very fortunate.
That's great. I hope I can be in a similar situation when I graduate from residency. Lastly, how can trainees learn more about and get involved in sports psychiatry?
So I think the best place to start is probably the International Society for Sports Psychiatry. They have developed an educational program to get a certificate in sports psychiatry. It's not like boards. It's not like that. It's just a certificate given by the ISSP through the educational program. And Claudia Reardon, the woman I mentioned earlier, she is the head of that committee and has developed that program mostly. And that is really a good place to start. I think if someone thinks about in their residency doing an elective, if there is a student counseling center or a sports medicine rotation or some, like just asking whether the university has a sports psychiatrist or program in sports psychiatry, or whether the elective could be done with a sports psychiatrist that is in private practice, for instance. Those are all good options to kind of get a taste of what it would be like to work as a sports psychiatrist and pursue that kind of career. Again, the International Society for Sports Psychiatry, we have a mentorship program. So if a young person, a medical student or resident, contacts the International Society for Sports Psychiatry, they can be paired up with a mentor.
Thank you, Dr. Frankel, for that wonderful response. It looks like the International Society of Sports Psychiatry is a great starting point. Anything else you'd like to add, Dr. Frankel?
Well, I want to thank you for having me and for giving me a chance to explain a little bit about sports psychiatry. If you are interested in this field, you can find mentors. I think that's important to remember.
Well, thanks again, Dr. Frankel, and thank you everyone else for joining us for another episode of the AJP Residence Journal podcast.